You want to know how long a critically ill patient in intensive care can be on a ventilator before there's brain damage. Stay tuned, I've got news for you. My name is Patrick Hutzel from intensivecare.com, and this is another quick tip for families in intensive care. This is a question we once again get quite frequently, which is why I'm answering it today. So, the duration of a time a person can be on a ventilator before brain damage in intensive care occurs depends on several factors, such as the underlying condition, the person's overall health, and how well oxygen levels are maintained. Brain damage can occur if oxygen levels in the blood drop too low, which is also known as hypoxia, for an extended period of time, which can happen if the ventilator isn't able to adequately supply oxygen or remove carbon dioxide from the body. In more general terms, short-term use of a ventilator, a few hours to a few days, typically doesn't lead to brain damage as long as the person is receiving adequate oxygen and carbon dioxide is being effectively managed. Prolonged use, weeks or more, can increase the risk of complications, including brain damage, if the patient experiences low oxygen levels, high carbon dioxide levels, which is also known as hypercapnia, or if there are other complications like infections or organ failure. Some of the key factors that influence the risk of brain damage include oxygenation and ventilation management. If oxygen levels in the blood are consistently low or carbon dioxide levels are too high for long periods, this increases the risk of brain injury. Next, underlying medical conditions. Pre-existing health issues such as chronic respiratory diseases, heart disease, or severe infections may affect the ability to recover. Number 3, ventilator settings and adjustments. If the ventilator settings are not optimized for the individual patient, it can lead to complications, including potential brain injury. It is important to note that in cases where brain damage is a concern, healthcare teams closely monitor oxygen levels, brain function, and other vital parameters to prevent or mitigate long-term effects. If you're concerned about a specific situation, it is absolutely crucial to consult with the intensive care team. But that also ties right in with long-term effects of an induced coma, where patients are being induced into a coma when it comes to intubation in ICU with a breathing tube in a patient's throat, right? That goes into the lungs. And that can also have significant impact on the brain, not necessarily long-term brain damage, but it can have impact on behavioral issues. It can cause ICU psychosis, ICU delirium, which can also have long-term impacts, right? But that's for another separate week video, where I will talk about the long-term effects of an induced coma and how it impacts on the brain as well. And that also ties in, today's topic also ties in with, how quickly should you do a tracheostomy if someone can't be weaned off the ventilator? I mean, those are topics that I've talked about at length on my video blog here at intensivecare.com. And just why can I answer all these questions? Well, I am a critical care nurse, and I have been working in critical care for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care and critical care. And I've been consulting and advocating for families in intensive care here at intensivecare.com since 2013. And I can very confidently say that we have saved many lives with our consulting and advocacy. And you can verify that when you go to intensivecare.com and you read our testimonial section, or if you go to intensivecare.com and you watch our intensivecare.com podcast, where we've done some client interviews verifying that we have saved their loved ones' lives with our consulting and advocacy. And we have helped hundreds and hundreds of members and clients over the years, once again, to improve their lives instantly, including saving their loved ones' lives with our consulting and advocacy. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly, and I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And that will help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. I also talk to doctors and nurses directly as part of my consulting and advocacy. And when I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. If you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly in the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And the access to me and my team, as well as the access to ebooks and videos, exclusive access to ebooks and videos, once again, will help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video, and share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.